Squats and deadlifts, two of the most effective exercises that everyone really should be doing, and two that are often performed incorrectly by many beginners and experienced lifters alike. The squat and deadlift are not super complicated lifts like the clean and jerk, but a lack of flexibility will restrict the ability to perform them properly. This will greatly reduce their effectiveness and increase risk of injury. So here are the common flexibility issues in each lift and how to correct them. First up, my personal favorite, the deadlift. Now I'm sure you've all seen it, the gym bro trying to deadlift, looking like your dog about to take a mad dump. So what's the issue? Tight hamstrings. If your hamstrings are shortened and tight, you will not be able to straighten your low back, which is necessary to perform the deadlift. A rounded low back at the start of a deadlift is a recipe for injury. Do not perform a deadlift until you can properly straighten your low back at the beginning of the lift. You will get injured. To stretch, you'll need some object below waist height that you can place your foot up on, like a chair or staircase. Put your foot up with your legs straight and try to bend over at your hips while keeping your low back straight. None of this rounding over and touching your toes nonsense. For many, just keeping your low back straight will be enough to start. Hold daily for 15 to 30 seconds. Once it becomes easier, bend over slightly more at the hips while keeping that low back straight. Next is the squat. Now the squat can have many mobility issues, but areas like the hips are usually already taken care of. Instead, I want to discuss the joint that I find is overlooked the most, the ankles. When performing the squat, the bar should stay over your midfoot, the middle of your base of support, through the entire range of motion. If the bar moves outside of this base of support, you will fall. As you squat down, your hips will move back and your knees will travel forward in order to keep that bar above midfoot. The distance your knees can travel forward will be determined by your ankle mobility. If your ankles are very stiff, your knees will not be able to travel forward much, meaning your hips will have to compensate by bending over more, and for most, that means low back rounding. You don't want that. To help fix this, we want to stretch the ankle through dorsiflexion. Stand a few feet away from the wall. Lean and brace your upper body against the wall. While standing on one foot with the other crossed behind the other, bend your knee as far as you can while keeping your heel planted and hold. Your heel should not come up. Perform this daily for 15 to 30 seconds, and when it becomes easier, push your knee further forward. Remember, these are only two stretches to be added to an already sound routine to help your mobility with these two lifts. These will not make your deadlift and squat. In order to get better at those two lifts, you gotta practice good technique. I hope this helps, and thank you for watching.